Good evening, everybody. I'm Dr. Suchit Tamboli, a developmental pediatrician working since last 31 years. And we are going to see today about autism. So, how actually we should understand autism. Actually, there are few cases I want to stress. One is Rahul, who is 2 years old boy. His parents have previously brought to me my clinic for immunization. Now they are concerned that he is not talking. He was born to healthy parents after a normal pregnancy and delivery. His physical growth and motor skills have been age appropriate, but now Rahul makes less eye contact, seems less interested in interacting with his family. He is not interested in playing pretend games. He loves watching videos, particularly one cassette which he insists on watching several times a day. He has several tantrums, particularly of his daily routine is altered in any way. His physical examination is completely normal. So such type of Rahul or Ali or Dhruv, there are many children who are coming with nowadays with the problem of autism. So why autism we should understand, because it is very unique in nature. It is apparently normal looking child with so many abilities and skills not functioning in a social setting. And when assessed on a developmental scale, they show total lack of uniformity in different areas of development. And their children have to be diagnosed on the basis of clinical suspicion. There is no other way for the diagnosis. So actually here most important thing is that there is qualitative impairment in reciprocal social interaction and social communication, restrictive, repetitive, and stereotype pattern of behavior or interest, and they may have unusual response to sensory experiences or sensory perception. Nowadays, 1% of total world population, 1 in 69 in India. The prevalence has doubled in last decade, and even after Corona, it has increased, which is again there is difference between pseudo autism and autism, which is actually online. When children are there online for more than 2 hours or 6 hours, then they have some problems. So such parents also should know that what is autism. So here, what is important is that more boys than girls are affected. Common age of presentation is 1.5 to 3 years, and we do not know the cause. That is most important. So there is no structural or functional problem in the central nervous system. Cause is never known. You cannot cause a child to become autistic. That is very important sentence, because it is caused by different factors. Like autism the parents usually ask that whether it is due to unhappy home environment or mental stress or poor handling by the mother or emotional trauma or psychological factors. But no, you cannot cause a child to become autistic. It is a problem which is there, and it is not due to your home environment. And there is some role of genetic. There is triad of impairment in autism. There is language and communication impairment, social impairment, and restrictive, repetitive, and stereotype pattern of behavior or interest or activity. There is important thing is to remember is that many parents tell us that at 12 months he was uttering few words, but now he has forgotten. So regression between 12 to 18 months is very common. Language regression, social regression, and play regression. So that is very important. So what are the actually how the child will present to you? Onset before 3 years of age, impaired ability to develop normal social skill or lack of contact, or often do not engage in pretend play. The delay or failure in acquiring speech, which is very common. And what are the red flag signs? They does not babble by 1 year of age, does not point to object or people by 1 year of age, does not make meaningful gestures by 1 year of age, does not speak one word by 16 months, does not combine two words by 2 years, speech not understandable by 24 months, does not respond to name, loss of language or social skill at any age, decreased use of non-verbal behavior during communication, that is eye-to-eye gaze or facial expression, body exposure, poor eye contact, does not smile in reciprocation, excessively line up the toys or other object, absence of joint attention, does not share the enjoyment or interest. And what are the red flags? Like decreased interaction with the peers or friends, does not play with the toys appropriately, fixed pattern of interest, lines things up, repetitive behavior and demonstrate echolalia, that is repeat the word मैं मुझे ये चाहिए, so like that. So actually MCHAT is the test which should be used for screening at the age of 18 months to till 24 months, which is very good test, and it can be used from 16 to 30 months. And it is very important that these children usually they don't have they point out with the finger that whatever they want, they will take the parents to that object, and they doesn't respond to being called. There is they may not follow the command. They do not copy or wave bye bye, or they may not do clapping. So such type of children are there. The parents are very worried that whether the child is deaf or not, or unusual finger movements are there, upset by everyday noise. Cooker ke city bajti hai to bhi they get annoyed. So that is very important. And actually unusual attachment to some object, imaginative play वो करते नहीं है. So there is tactile, auditory, olfactory, visual, gustatory, and vestibular problem in these children, and they overreact to the sound. There is social problems, serious problems in the everyday life. So that is very important. That is affect their school performances also. So they prefers to play alone, avoids eye contact, inappropriate facial expression, trouble understanding other people's expressions, and they do not understand how to develop friendship, and they don't know how to take turn and share. They do not want to play with the other children, and that is very important. So they are sensitive to be touched. Self-stimulatory behavior is there. 40% of children, they do not talk at all, or they may not. They may lose the talk which they have acquired, and there is delay in the speech, language, reverse pronunciation. They talks in a flat, robo-like or sing-song voice, which is very common, and only one word at a time, or others repeat the same word or phrases over and over again. So actually, echolalia is again very common. Communication is very hard with the children, and they does not understand the routine method of teaching, and they stand too close to the person they are talking, so that they might stick to one topic or conversation too long, or they mean actually when they tell I, actually they mean you, or vice versa. So there are kids speak is there, unusual behavior like unusual interest are there, the obsessive interest are there, repetitive motions. They like all other repetitive flapping of arms or turning of head. So such type of things are very common with them. There are other symptoms like temper tantrums. Then other they may laugh inappropriately or cry inappropriately, and they are very good at putting puzzles together or solving computer problem, but maybe have some other developmental problem. There are misconceptions like absent, no eye contact, they are not affectionate, or they don't talk. So they can talk difficult word also. No treatment is available, but actually they have better outcome with early and intensive intervention. So most important is that autism is a lifetime diagnosis. Medical assessment is there with the physical examination, developmental screening, hearing screening, relevant investigations. No specific investigation is there, which but only tests are there which are standardized and that should be given to the parents. No prenatal or carrier stage diagnostic test is available. Hearing evaluation is mandatory. Differential diagnosis like ADHD, conduct problems, hearing problems are there, and actually there is DSM-5 test, which is very gold standard, and it gives proper diagnosis. And most important is that whether the child requires substantial support or very substantial support or requiring support is very important. According to the severity of diagnosis, we manage the treatment. So team effort of the parent, teacher, doctors, therapists, medication and behavior modification as well as regular monitoring is definitely there. So suspect first impairment in the social interaction and communication with restrictive repetitive pattern of activity and behavior. Clinical diagnosis, early diagnosis by MCHAT, and earlier is the better. DSM-5 is current standard of gold standard for the diagnosis. I think I have given outline of the autism, and parents should go through that so that they can understand and they can take developmental pediatrician opinion. Thank you very much for patient listening.